So we are here for our last session, and it is my pleasure to introduce Giuseppe Maniaci, who is a researcher and is also a clinical psychologist. He's the main clinical psychologist working at the clinic that Erika and Laura just presented. So thank you, Giuseppe.
Thank you, Diego. Thank you all. I'm also talking for Professor Barbera. Unfortunately, he's not with us today, but I'm bringing you his greetings. So I'm going to talk about a brief literature overview on gender dysphoria. This doesn't work. Ok. No, comunque non va. C'era un altro? Poco fa andava. No, perché va. Il puntatore va. Okay, anyway, I'm going to talk about four topics. So first of all, the problematic issues in research involving trans people, then the psychiatric comorbidities in gender dysphoria, the brain functioning of trans people, and the utility of psychotherapy.
So while sorting this little technical issue, I just want to say really thank you to the Palermo team, because they, this clinic actually raised from a need, as Erika said, from a patient who some years ago apparently the transition was made, but without a proper psychological assessment. And so from that point, it was evident that they needed a proper service for evaluating psychologically all people that wanted to do gender transition. And so they developed this service, and this was an important achievement. Yeah, Alex? It's a public service. Yeah. And the important thing is that having such an extensive clinical assessment is very important, because with some of you we discussed that there has been a massive increase of people that are requesting gender transition, and of course we need therefore to understand clinically and psychologically who are the people that for whom is right to go through this process.
Okay, yeah, you are ready. I'm talking from this position. Okay, so first of all, I'm going to talk about some problematic issues in research involving trans people. Okay, so gender dysphoria or gender euphoria. So according to what Erika and Laura told before, not all the trans people living a condition of gender dysphoria. Our aim as clinical psychologists, as psychiatrists, should be to put trans people in a condition of gender euphoria. And if we are able to do that, they can be more happy about their gender affirming path. So they can live a state of gender euphoria if they are not bullied, if they are not stigmatized. So this is our first aim. The first controversy is about the diagnosis. So do we really need the diagnosis of gender dysphoria? Some people are not comfortable with this term. And if we talk about transgender individuals, we are not talking about people who have some kind of psychiatric disorder. Do we need a diagnosis or not? The answer is yes, because thanks to the diagnosis, we can give to these people the treatments. So government can pay for treatments such as hormones and surgeries. But both the trans community and people in the medical community are struggling to solve this issue. So what we can do for giving to those people the treatments they need without leaving them in a condition of a psychiatric disorder. In Spain, for example, 3 months ago, the Spain's parliament has approved new legislation that will allow anyone over 16 to change their legally registered gender without medical supervision. So in Spain, they decided to give a relevance to the self-determination principle. So if you are over than 16 years old, you can choose, okay, without any medical supervision, you can choose about yourself. So you can change your name, you can apply for having a certificate. And this is their decision. In UK, as we said before, you can apply for a gender recognition certificate only if you are aged 18 or over, if you are diagnosed with gender dysphoria, and if you've been living in your affirmed gender for at least 2 years, and if you intend to live in this gender for the rest of your life. You can apply only if you are in a binary situation. So you can apply if you are a trans man or a trans woman. You can't apply if you are a non-binary. And this is a bias because we treat a lot of non-binary people. So we should give to them some kind of route to follow. And in Italy, it's quite the same. So we don't have a specific legislation that establishes an age for gender transition, but such a change before the age of 14 is extremely rare, except in cases of birth defects. So we can apply, as Erika told before, if you are 18 years old, you can receive surgeries, but you can receive the hormonal treatment since 16 years old. So the situation in Europe regarding the trans rights is quite heterogeneous. So in this map, this is the latest one. The darker the color, the higher the level of protection. As you can see, we have a very heterogeneous map. So the country where trans rights are more protected is the Iceland. In this country, the Act of Gender Autonomy provides for the right of persons to define their own gender, thereby aiming at guaranteeing the recognition of their gender identity. Every person from the age of 15 has the right to change their gender registration in Registers Iceland. A child under the age of 15 may, with the assistance of its guardians, change its official gender registration. So in this country, trans people are more protected. And so, for several authors, the hope is that in the future, WHO takes the same route as homosexuality, demedicalizing transsexual, so removing it from the ICD. And when we do some research on gender dysphoria, we will find several bias, several difficulties. First of all, the small sample size. Gender dysphoria is still a relatively rare condition, so we don't have too many research with a large sample size. Secondly, the stigma and discrimination. Many of the trans people, like Enrica and Gabriele said before, lived a condition of stigma and discrimination since the childhood. So we have to do something. We have to do many research on this field, trying to help people to reduce the level of stigma and discrimination. Then the complexity of the condition. We still think binarism. We still think using binary categories. We still think about male to female or female to male. These are old way to define transgenders. We have to talk about trans men, trans women, because they are like cisgenders. They are men or women. They had they were born in different bodies, but they are like cisgender people. So we have to investigate this condition, trying to avoid binarism, both in our way to talk with them and also in the research. So we have to consider much more the non-binarism approach. And then we have a lack of longitudinal studies. There are not many longitudinal studies, and we really need to do this kind of studies to investigate something about the etiology of this condition and how we can do to reduce stigma and discrimination, and what we can do to treat those patients faster, because they usually they want to go fast. They want to receive hormones treatment and surgeries very soon. And so if we do research on investigating this field, we really can help them. So both the American Psychological Association and the World Professional Association for Transgender Health strongly recommend that an adequate psychological assessment is essential in order to evaluate the psychological functioning as well as the impact of stigma and prejudice on transgender people's mental health. So we all agree that we have to do a very good psychological assessment, but sometimes we find some risks. So we have to be aware, for example, that many measures have been statistically normed for various demographic specifications, such as female and male genders. So we have binary norms. So if I have to use one of these tests, for example, the MMPI-2 or the Millon Clinical Multi-Axel Inventory, to investigate on psychiatric disorders or personality traits of trans people, which sex, which genders we choose for a trans man? The male version or the female version? It's not so easy, because if we choose the wrong version, we can have different results. We can find bad results. A good a possible solution by choosing the use of this test is based on this kind of research. So we know that hormone treatment is going to change brain connectivity, and we know that hormone treatment is going to change also the personality. So we can choose the best personality test basing on the specific stage of the gender affirming path. For example, we can choose a male version when a trans woman is at the start of her gender affirming path. And we can choose the opposite version when the trans woman has begun the hormone treatment. Furthermore, we can use this kind of test. We can use several symptoms inventories, because they are not based on gender norms. So we can use those tests with the awareness that many trans people can feel a lot of symptoms, psychological symptoms, such as anxiety, depression, and body image concerns. And then we can rely more on the history in light of gender dysphoria. So we can give a lot of importance to the psychological consultation, the psychiatric consultation. Furthermore, we have a lot of inventories that aim to analyze the specific level of gender dysphoria, both in children and adolescents and adults. And another good, today, before we were talking about projective tests, using, for example, the Rorschach could be a good way to evaluate the gender dysphoria personality because it's a non-gender normal tool. So we can use the Rorschach test both for trans men and trans women, and we can use this test in all the stages of the gender affirming path. So this could be another good suggestion. Secondly, psychiatric comorbidities in gender dysphoria. So do trans people have a higher level of psychiatric disorders compared to cisgenders? It's not so easy to answer to this question. So we usually find a mixed result. However, a recent systematic review have analyzed that trans individuals compared to the general population or cisgendered persons are diagnosed with a mood, anxiety, or psychotic disorder with ratios of 1.5 on 1, 3.9 on 1, and 3.8 on 1, respectively. Similarly, the prevalence of non-suicidal self-injurious behaviors and completed suicide was estimated to be 13 times higher in the transgender population. The social stigma appeared to be associated with an increased prevalence of mental disorders or on mental health complaints in the transgender community, and several papers reported on the high prevalence of substance use disorders among trans individuals. This is quite easy to be accepted because, as we said before, many of transgender people experienced a strong level of discrimination, a strong level of behaviors against their gender from other people, so they can suffer from that. They experienced several levels of minority stress, and this lead to several consequences on a psychological plan. According to this systematic review and meta-analysis, LGBTQ people report a higher risk of suicidality compared with their cisgender heterosexual peers. And this is related to the direct and ambient discrimination. And the suicidal intention that several trans people experience is related to this kind of discrimination, but through mediation of the psychological pain that this condition create. So living a state of discrimination or living a state of stigmatization can lead to several suicidal intentions through the mediation of the psychological pain. So we know that transgender people suffer from their condition, so we have to help them. But we also should know that genderqueer, so non-binary people, suffer more than cisgender and more than transgender people. So living in a condition of non-binarism could be worst, could lead to worse consequences on a psychological plan. If we compare, for example, the harassment, the trauma, sexual assault, self-injury, contemplated suicide, current suicidal ideation, suicide attempt, generalized anxiety, social anxiety, depression, distress, eating concerns, and alcohol use, we can highlight higher levels in genderqueer compared also to trans people. And in a study we published last year, we have found no significant differences between transgender and cisgender on several psychiatric disorders, but we found significant differences on several dimensions of body image and on self-esteem and on quality of life. So transgender people compared to cisgender have lower level of self-esteem and strong body image concerns. We should help them to reduce this level of dysphoria, and we can do that through the hormone therapy and through the surgeries. Indeed, comparing transgender in hormone therapy to transgender hormone naive, we have found that self-esteem is increased after the hormone therapy. Also, the quality of life and the body image concerns are going to reduce after the hormone treatment. So, brain functioning of trans people. Do trans individuals' brain most resemble those people with whom they share gender identity or birth assigned sex? This is a relevant topic, and the research are quite heterogeneous, so we have mixed results. But now there is a good amount of research that highlight that they have their brain is more similar to the aspired gender. Even if some structural neuroimaging studies highlighted neuroanatomical similarities between transgender and cisgender individuals sharing the same birth assigned sex, other research found no differences, and several research instead found out that transgender brain is similar to their desired gender since an early age. Another relevant result of neuroimaging studies on gender dysphoria is that the hormone treatment is going to change the connectivity. The hormone treatment is going to change their brain, leading to greater similarities with their aspired gender. This is related both to the default mode network and to the silence network. These give us a strong message before we start the hormone treatment, before we can help those patients to be in their aspired gender. Also in this study, the authors revealed patterns of resting state functional connectivity that were different from both men and women in trans women. And then the hormonal treatment seems to shift trans women more toward the aspired gender. So we have to go beyond binarism. We have to go beyond to find similarities or differences between trans men and trans women and cisgender one. And we have to give more importance to analyze, for example, the transgender brain. It remains unclear whether such changes in the brain connectivity after the hormone treatment correlate with behavioral and psychological changes often reported by gender dysphoria individuals following hormonal treatment. And we did a research on that, and we recruited 25 transgender men, 14 cisgender women, and 14 cisgender men. And we highlighted several similarities between transgender men and male cisgender males. For example, in the left precentral gyrus, inferior frontal gyrus, pars opercularis. We have found we found out an increased resting state functional connectivity in males compared to trans men in the subcallosal cortex and cingulate gyrus anterior divisions. An increased resting state functional connectivity in males compared to trans men in the paracingulate gyrus, frontal pole, and superior frontal gyrus. Also, in the left temporal pole, frontal orbital cortex, and insular cortex. And also in the cingulate gyrus, both anterior and posterior division. So in this research, we found out that connectivity in areas involved in body perception may be some specific neural correlates of gender dysphoria, and the most important common denominator in trans individuals with GD could be the high discomfort and uneasiness related to their body perception. Okay, I'm going to talk about the last point, so the utility of psychotherapy. This is another controversial topic. We all, there is a very heated debate. We all agree that we have to ban any conversion therapy. We don't need to, trans people need compassion. They don't need conversion. So we all agree with that. But we still have to do some for them. So even if we are sure that trans who have experienced gender identity conversion efforts are going to show more suicidal attempt, mental health problems, even if we are aware about that, we still have to use psychotherapy with these people. So what we can do? We can avoid to do some conversion therapy according to the WU path, but we also have to consider that some people can decide to do the transition process. Erika today talked about the case of Kira Bell, but we also had some cases in psychotherapy who decided it happens 3 times that transgender people decided to stop psychotherapy for a little time and then started again psychotherapy because they wanted to be more aware, more sure that this path was the best one for them. So what we can do is following, for example, these suggestions. They criticize the Tarban et al.'s work because in that work they chose to view psychotherapy through a binary of affirmation or conversion therapy. So we have to go beyond these binaries again. We have to think psychotherapy, for example, as an exploratory psychotherapy. We have to help those people. Those people, I was very happy to see Gabriele and Enrica today here. I'm their therapist, so I'm proud of them path. I'm very proud of them. So also for a therapist is very good to see that people, your patients, are going to achieve their aim, are going to increase their wellness, and of course are going to reduce their dysphoria. So we should help them, and an exploratory psychotherapy could be a good choice. So we have to spend some time with them. So the overall goal of psychosocial therapy are to improve the patient's quality of life through open and consistent communication, to support patients as they begin to implement their gender identity to their loved ones and society, to guide patients with coming out to friends, family, and colleagues. And then the summary. So even many research have been done, much remain to study. Gender dysphoria is a condition of a strong distress, and people who suffer from this condition need to be helped to reduce their dysphoria through non-surgical and surgical treatments. So this is the treatment. We don't need to do conversion therapy, but we need to help them to hormone and through surgeries. There is a strong need to go beyond gender binarism. Then psychotherapy is a fundamental treatment for helping trans people to improve their quality of life, to support them in coming out to friends, family, and colleagues, to work on specific psychiatric comorbidities, and to help them to adequately manage the post-surgical. This is a strong message I want to do today, because we, as therapists, as clinical psychologists, and as psychiatrists, we have to help those people even in the post-surgical condition. we don't have to forget that our first role is to guide them and to support them. So if we help them also during the post-surgical, the compliance with the treatment is better. And finally, this condition, more than others, should be investigated through a scientific point of view, putting aside every kinds of ideologies. Thank you so much.
Thank you, Giuseppe, not only for all your important clinical work that you as a team are doing, but also for identifying this research gap. So this was very important. And I just would like to ask the audience if you have, we have time for a couple of questions. Marta?
I was very interested, Giuseppe, in the data you show on brain imaging, because in some way it goes back to what Gabriele and Enrica were sharing, that they felt the gender that then they chose from very early in age. And I wonder, are you aware of any genetic study that have been done on, of course you will need large sample of transgender people?
Yeah, I'm not really aware about some of these studies, but there are some researcher groups that are trying to investigate also on the relationship between genetics and environment. Today we are not so sure about what is happening during the neurodevelopment to the onset of gender dysphoria. Today a strong theory is that there is not a match between the genes, the double X or XY chromosomes, and the effect of testosterone during the pregnancy. So the way the brain is going to be more masculine or in a female or male direction, if this is not congruent with the genetic assigned, yes, this can create a state of gender dysphoria. So today, this is the more common theory.
That's a very interesting point. So thank you, Marta, for the question. We have time for another one. Yes.
Hi. I think I've had a strong sense of what a well-established clinic that you have here, which is really good at looking at people and making that diagnosis properly of gender dysphoria. I guess the bigger problem that seems to happen in most countries, and alluding to what's happening in England at the moment too, is what about that whole other mass of people, young people coming through early adolescence with confusion about their identity on so many different levels, often vacillating between their sexual identity as well, and being caught up with trying to work out who the hell they are on all levels. What do you, in a clinic like this, people are getting to that point where it gets very clear they truly have a gender dysphoria, but what are we doing about this early adolescent bunch who, where it's very unclear what's actually going on, and how are you supporting them in this community?
Okay, so how we support children or adolescents with gender dysphoria? Okay, this is the question. Okay, we work in a psychiatry unit, so we can help only people over 18 years old in Italy, in our unit at least, okay? But in my private office, I usually help also adolescents with gender dysphoria. One of the most important strategy is to share this condition also with their parents. So if trans people feel guided from you, feel supported from you, and if they feel less discriminated from the environment, they can be sure that they can be more brave, like Enrica and Gabriele said before. Okay, maybe they would have been like to make this choice before. Okay, they said that, but maybe they didn't receive a right guide in that moment. Okay, so as Gabriele said before, if we increase the number of clinical psychologists in the school, for example, people with this condition can feel more happy and more safe to trying to explore this thinking. Okay, because today they know that they were sure about their condition since the childhood, but maybe some of them could change their mind. Okay, so if they have the right time, so if we do an exploratory psychotherapy, so if we spend the right amount of time to help them, we can achieve the best goal.
Can I just say that Giuseppe had the great and most difficult task of concluding the forum, which means that we're all rushed and some of you have to leave. So I want to particularly thank him with a big applause for doing that and doing that so interestingly and remarkably. Thank you, Giuseppe.